Wonderful. So I'll go ahead and call the meeting to order. Welcome and roll call.
Great. So Dr. Jameson?
Here.
Valerie Clark?
Present.
Lavon Lewis? I do not see her. Dr. Friedman?
Present.
Jonathan Johnson? All right. Jose Melendez?
Here.
Quincy Branch?
Present.
Suzanne Bierman?
Here.
Hello. Commissioner Richardson? Let's see her. And Aaron France.
I see the
you,
name.
Aaron. I'm going to mark you.
Name.
Madam Chair, we have a quorum.
Excellent, thank you. And first, as I already said, welcome back, Heather. And we're so excited to have you with us.
Thank you.
Once again. And where did that time go, right? Or was that a agonizingly slow legislative session? Slow.
I would say it was long days and short months.
Exactly. When you're really busy, time flies. And you were really busy.
Yeah.
And as always, while you were gone, your team, well-oiled machine, smooth as silk. And so that's to your credit and all of theirs. So announcements, nothing else. And public comment. Do we have any public comment?
Madam Chair, there is no public comment in our office. Is there any on Zoom? Anybody on Zoom wanted to public comment?
There's no comments at this time.
Okay, thanks, Katie.
All right. Well, we literally are going to zoom right along to the approval for the minutes of February 25th board meeting. And do I have a motion for the approval?
Valerie Clark, so moved.
Quincy Branch, second.
Thank you, Valerie Quincy. And is there any discussion, after reviewing, did anybody find any concerns, omissions, any edits, any corrections? Hearing no discussion or items, then we will have a vote. Everybody in favor of passing it. You could either put your little hand up or we can just say aye. There's a very small group. So I think the aye would work. Everyone in favor of passing?
Aye. Aye.
Aye.
Got it. It is passed. And now the ever so exciting part, which we all look forward to, our executive report. Our wonderful executive director, Heather Korpalik, could you please take it away?
Yes, thanks, Madam Chair. And as just a point of privilege, I would love to take a minute just to thank my entire team at the Exchange, the entire team at the Exchange who held down the fort in my absence, and not just held it down, but actually grew us in a pretty significant way. And I just wanted to make sure to put on the record that they are the best. And I'm very lucky, and that's why I keep coming back, because this team is awesome. And I also wanted to make sure, and I think you all have met our Deputy Attorney General, Michelle, who is on the Zoom call in the capacity of helping us with some other things, but I wanted to make sure, and I'm not sure if that's been made clear yet, but she is now our agency's acting Deputy Attorney General, and we're very happy to have her. And then another introduction, you can't see her on TV, and I don't have a fancy camera yet, but Megan Worth-Ranson is a new add to our team at the Exchange, and she has taken over plan certification, and we're very excited to have her. She works with me at the governor's office and has kind of a long legacy and history in the state as being just like super capable, and I was happy to steal her and bring her over to the Exchange. And then in sort of bittersweet and sad news, one of our sort of founding employees, Jamie Sawyer, who has been with the exchange for almost as long as I have been, has taken a job, and it happens to be with Get Insured, our vendor. So she's going to go over there and advocate for us on the other side, but we are going to miss the heck out of her, and she's been instrumental in making the exchange into what it is and as functional as it is, and so it's a big loss for us, but a huge gain for them. With that, I'm happy to kind of go over the Executive Director report, which I will try to fly through. I do want to say that this was super helpful for me to have this, the timing of this report. As you all know, we, every 6 months, are legislatively required to put forward a fiscal and operational report to the governor's office and the legislature. And so in my absence, and I was happy to read all of the great things that have gone on over the last 6 months. And so my director's report is really largely taken from that material. And so I'm going to do my best to just breeze through it. So if I don't read every line, forgive me, but it's all on paper for you if you want it. So like I said, this report is really closely aligned to the fiscal and operational report that you all should have and that we're looking at today for final approval, right? Yes? Yeah, okay, just making sure. As you're well aware, the first half of 2021 has not been any less interesting than the last year of pandemic, and in fact, it's been pretty wild for the exchange. We've been doing and implementing 2 special enrollment periods. First was that first special enrollment implemented by the Biden-Harris administration, which was really designed to address COVID and the gaps in insured population as a result of the pandemic. And then from there, we implemented American Rescue Plan special enrollment period, which started on April 19th and runs through August 15th. That was a really exciting SEP, and we'll get into it a little bit more, but the American Rescue Plan is significant in terms of healthcare legislation. Probably I would just hands down say it is the biggest piece of legislation since the Affordable Care Act, and will have just a huge and significant impact on Nevada. So we're really excited about that. Throughout the last 6 months, the exchange has also overseen our contract with the technology platform Get Insured, really worked closely with our call center. We had a legislative session and we presented our budget and were able to successfully accomplish what we were hoping to achieve, which is to get 4 new positions built into our budget. We planned and executed our technology releases, strengthened our working relationships with different state agencies, including theater and welfare, Medicaid, DOI, I would add. And as we prepare to head into our 3rd year, which is unbelievable, as a state-based exchange, the leadership and the staff have been really working on improving and refining our policies and our processes in order to provide a technology platform that really offers the most efficient operations and service to Nevada consumers. With vendors, you probably are all aware that successful operation of an SBE really does require successful and functioning technology and accurate eligibility and policy, along with that scalable call center. We have been working very closely with Get Insured to monitor the performance of our enrollment system and assist with the prioritization of system improvements. Our QA team, or our quality assurance team, coordinates regularly with the call center and Get Insured to make sure that we're satisfying all of our consumers. The COVID pandemic in March of 2020 was another challenge for the Get Insured technology platform, and they stood up and rose to the occasion, and they provided both of those special enrollment periods, both the Harris-Biden one and the Arpa one. Highlights from our Arpa technology changes included some really awesome new opportunities for Nevadans, which are additional subsidies for people over that 400% of the federal poverty level, and then additional enhanced subsidies for people who were already getting them, so more generous subsidies for people who are already subsidized on the exchange. And on top of all of that, we were also able, I'm just winging this, guys. This is not even written down. Sorry, I don't feel like reading this right now. But basically, we were able to implement unemployment insurance changes too. So anybody who is collecting unemployment insurance in 2021 is eligible for a $0 plan on the exchange. So all of that happened in a significant, short time period. We, in June, in the beginning of this month, ran renewals on every single application. So if a consumer had not come over to the exchange and made changes to their application, we we ran the changes to their applications, and so all of those consumers on the exchange are now receiving the enhanced subsidies that are due to them. Moving on, we've been coordinating with other state agencies and making sure that we have these cross-agency partnerships and collaborations. Administrator Bierman is on the line, and she knows we talk a lot about how our agencies can cross-collaborate and what we can do to make sure that we're managing the Medicaid growth and the exchange growth and making sure that consumers don't fall between the cracks. And so we have been meeting with the Division of Welfare and Supportive Services pretty regularly, thanks to Jennifer Krupp, our CFO, to explore a partnership with our Navigator program so that the state, and to couple that with the state's Medicaid program. And basically what this program will do will allow the exchange to provide additional outreach and education services to Medicaid and Nevada checkup recipients. And basically, we discovered that about 25% of our Navigator entities' time goes to Medicaid and checkup. And so we are working on a partnership to collect some revenue, or to collect some funding with a federal match from CMS to augment those services and to really increase the exchange Navigator capacity to do outreach for those populations. I think you all know that I continue to be an ex officio member on the Patient Protection Commission, which is undergoing a pretty significant change in its makeup in the next few months. So I look forward to working with them. Had a conversation yesterday with Administrator Bierman on the Advisory Committee on Medicaid Innovation and what we can do in that space as it relates to new legislation that came out this last session. Oh, I don't need to tell you about how important Arpa is. I think I've made a pretty convincing argument. We're working really hard, and all of these unfamiliar faces that you're seeing on the Zoom today are folks from the Abbey agency who jumped right in and have started with the exchange in engaging this population and really kind of marketing the new changes from the American Rescue Plan. They have not been bored, and we're really pleased with their accomplishments so far, and you'll hear more from them in a little bit. At a state level, this legislative session was anything but boring, especially for me in my wearing both hats roles. And so there are two pretty important pieces of legislation that will impact the exchange. The first is Assembly Bill 432, which designates the exchange as an automatic voter registration entity. And so basically what that does is it sets up requirements for our agency to transmit voter registration information to the Secretary of State and to county clerk offices. That is not something that the exchange is currently equipped to do and will likely come with some pretty significant technological endeavors. As many of you know, it is when you register to vote, you have to have an electronic signature, and so that is a complex piece of technology to try to work and implement. But we have 2 years to work through those technical requirements before that legislation is going to be before the exchange is required to stand that technology up. The second piece of legislation is Senate Bill 420, which has been commonly referred to as the Public Auction Bill. And this is a vehicle that will use ACA qualified health plans to facilitate the sale of a lower benchmark priced plan. I don't want to read this paragraph to you because I've been saying this all week. I'll just kind of wing it again and just share that the exchange is in the driver's seat largely in coordination with the Department of Health and Human Services and the Division of Insurance. We will be running the actuarial analysis on these plans and submitting 1332 waivers. And there are a lot of complex things about this bill that have already begun in terms of conversations with the Centers for Medicare and Medicaid Services and with other stakeholders. So just to give you I will report on these bills in every subsequent board meeting, but to give you a quick synopsis of what's next for the public option. The exchange will be convening stakeholder groups and having conversations with them about what they think needs to be included in our actuarial analysis. And then we will be going out to bid for an actuarial company to run this analysis. And then we'll be working hopefully with that company to do some hopefully they can help us because it's a significant undertaking to apply for waivers to the federal government. I am more than happy. I know there are a lot of questions probably from our board specifically about that. And if any of you want to call me at any time, we can have a really long substantive conversation at your convenience. Also happy to answer any questions when I finish my report too. Finally, two more things, we had our annual programmatic audit, and I will just say I am thrilled with the outcome. I was on pins and needles because it was our first audit of our first year acting as a state-based exchange, and I can tell you I was a little bit anxious about what this would look like, but we have such a great team. We only had two very insignificant findings that have pretty much been already addressed. One of which is related to some noticing for our appeals process, and the other, what was the other one?
Verification. I'm sorry. It was about the
reasonable opportunity period, which is a requirement on notifications to consumers who have data matching incidents and what we need to do to follow up with them to ensure that they are getting properly noticed about how to resolve those, which we're active. We had a meeting about it today. We're clearing up those issues constantly. So that was a good thing. And then finally, I am really excited and I can't tell you how important this is. We have 4 new positions that were approved in our budget. This report's a little bit behind. This week, we were notified that 2 of those positions can start effective July 1st. So yay, and thank you, Aaron France. And I just also wanted to share, so one of those positions will help in our quality assurance unit that is had an extremely overwhelming year because we've basically been in an open enrollment period since February. Our quality assurance team has been working around the clock trying to address consumer issues, and this new person will be extremely helpful. We also will have another member joining our reconciliation team, and those folks are critically important to making sure that our system matches our carrier system, and so really excited about hiring somebody into those positions effective July 1st. We also have added a program officer, a helper in, what is it called, a health resource analyst, who is going to help us with a lot of data and analysis and reporting. We have an enormous amount of requests from all different sorts of folks asking us for information and data, and we could really use some help in this space. And then finally, we are going to be able to hire somebody to help with communications in our Las Vegas office, and we're looking to help find someone who speaks Spanish primarily, would be a great person to join our team. So with that, I am done and happy to take any questions from the board.
Thank you. That was a fabulous report, chock full of lots of good news and good reports and interesting things going on. And I can't thank you enough for the brevity and vigor with which you presented it. Woo! And I would like to first ask if there's any comments or questions from the other board members. Do I see anybody? I would like to make just a couple comments. In fact, instead of my usual dozen, it'll probably be like 2 or 3, because the report is so explanatory, and what is not there basically will be evolving and be coming back to us in more detail as the year goes on. And so even though I'd be curious to say, well, what about this and what if with regard to some of that legislative stuff, really there is so much to be done. And so first I just want to say that I feel that I just couldn't be more pleased that with regards to the legislative 2 points that we're going to help improve enrollment. Bravo. That was so brilliant. And I'm just so glad the exchange can be involved with that. Every opportunity we can do something like that in this state and boost voting is just amazing. And you know, it's amazing where people are putting this opportunity, and it's wonderful to have it parked with us as well now. And then with regard to the other major legislative issue, the public option, as I said, I'm really not going to say much there. As a physician, I think our executive director knows the physician community had great concerns, and many people felt it should have been studied a lot more before it was sort of revealed towards the end of the session, and that studies were more called in order. And I think the bottom line is now, what's the expression? The horse has left the barn, the train has left the station. And so that being the case, I have to say I am thrilled that our executive director is going to be working intimately to help explore this new public option and be part of the team that helps literally do the correct investigating, exploration, to try to figure out indeed how this whole thing is going to roll out. And so I'm just so glad you are intimately involved with the public option, because it needs to be aligned with our Silver State Health Exchange. And what better person and place than you and this entity to be working with the rollout of the new public option. And I just think that was brilliant, and I'm tickled about it. So despite a lot of the favor it may not have garnished from the physician community, it nationally is something that people keep crying out about. And bottom line is needed to be addressed. And now with all the people that will be participating, particularly our executive director and the exchange, I think it's going to be done the right way. So I'm excited to hear how it's going to be rolled out, and really will be excited to hear as you investigate more, study more studying, and in 2026, what will this animal will look like. And so the other thing was, you were just talking earlier about the wonderful review they were doing, and that the exchange was working closely with Get Insured, and unbelievably into our 3rd year, here we go. And that, the quality assurance team was really working very closely to coordinate with the call center of the Get Insured. So were there any significant issues?
Thanks, Madam Chair. This is Heather Corbulis for the record. I think in terms of issues, it's more of a conversation with consumers about, connecting them to, first and foremost, our number one question for the call center is, what's my password? I forgot it. And so that takes up a lot of our time. And then, I mean, we spend an enormous amount of time coaching and assisting our broker community and our navigators to help get them through the process. Maybe they hit a snag on a page, or they don't understand how to update someone's application, or they need help with something. So we do a lot of that too. And then, you know, there wasn't any significant technical issues. It was just a volume of people now applying and getting access outside of our normal enrollment period.
Very good. And then with regards to how intimately you do work with, you know, the Medicaid state, I was very happy to hear that your 25% of your time is utilized. You think that high, that you're going to seek some sort of reimbursement for that time from some.
Yes, so we've entered to the tedious bureaucracy of Medicaid, and we are working closely with them on their state plan in trying to find a way to do some cost allocation and a memorandum of understanding so that we can get compensated for and expand even our time with outreach to populations that kind of are on the cusp. So oftentimes our navigators are out talking to groups about the exchange, and also those folks are in fact eligible for Medicaid. So our navigators will enroll them in Medicaid, but now we'll also be accepting some compensation for that work that we're doing in terms of outreach.
That is so wonderful, because we all know that some people think that a little curbside consult and a phone call, that you know, it isn't time, and time isn't money. And yet you guys do so much of that, and you're really not getting reimbursed. And yet I do want to tell you, as we go into the fiscal report very shortly, that I'm so proud how much bang for the buck you guys get. We've been maintaining our coverage. We're doing so wonderful. And if we can get reimbursement and always be in a better place financially, that's a beautiful thing, because sometimes we've hit unexpected things and fortunately had a cushion early on from when this was initially set up, but we don't always, you know, so it's good to be able to do that. So I'm going to say, if there's any other issues that anybody, Heather, this is sort of a kind of off, but on the Medicaid and on the public option, will there be an opportunity for, do you think, some of the undocumented finally to be coming onto it?
That's a great question, Madam Chair. The way that the Senate Bill 420 legislation is written is that individuals who, that basically the same eligibility applies to those folks who are already eligible for the exchange to the public option plan. So we would not be able to address the undocumented. However, in the long term, and the conversation that's worth having is that if in fact we can show a savings to the federal government in terms of money saved on a lower premium costs for these public option plans, there is potential that we could take those pass-through savings, that the federal government would give us back some of those savings, and we could potentially set up a program to subsidize undocumented residents.
And of course, I know this sounds like a slippery slope, but at the AMA where I just got back, you know, one of the big things that we're pushing is for coverage for certain niches. And in our community, a huge one, as the AMA nationally, is the undocumented that need dialysis. And that is such a huge cost that if we could cover it up front, could save in their long-term cost if it was covered more regularly up front. And so perhaps we can start by going for little niches. No slippery slope, opening the door, you know what I mean? Because as you say, there could be real cost effectiveness there. And it's such an urgent need.
Agree. And Suzanne, I saw you add something to the chat. Did you want to share that?
Yes, and I was able to get off mute, so happy to make a donation, but I feel like my mute button's working. So I just wanted to point out, in addition to the public option pieces of Senate Bill 420, there were some provisions related to Medicaid coverage, primarily maternal and child health related expansions, and one that was also included in Assembly Bill 189 allows Medicaid to add eligibility for lawfully residing pregnant women who haven't been here for 5 years. So that is one way that we're going to be able to expand eligibility to that population, which we're really excited about.
That is so thrilling. Thrilling, being an OBGYN. Thank you for adding that. I should have actually added that. And that's almost getting a little back to where Nevada used to be.
Yeah, there's also some presumptive eligibility expansions for pregnant women. So if you would love to chat, I would be happy to do that offline or provide information to Heather.
Yeah, I'll reach out to you, Suzanne. Thank you so much.
Yeah, absolutely.
Okay, well, what a wonderful report. As we said, a lot of wonderful, exciting things going on to help access to quality healthcare in Nevada for everyone. So the marketing and outreach update. This is a real first for us, and we're so excited if our new team will introduce themselves and proceed.
Thanks, Chair Jameson. Nice to see everybody. Janelle Davis, Communications Officer at the Exchange for the record. I am actually not going to read my full report because I will be introducing our new agency of record, the Abbey Agency, and they will be presenting pretty much everything that my report says, in addition to some metrics of our recent campaign. I did want to talk a little bit about the process of getting a new agency. All state agencies have to go through what's called an RFP. That's a request for proposal. So it's pretty rigorous, and I will say that this one for marketing and outreach services was very rigorous. We had a lot of people apply. We were with the prior agency for 5.5 years. We're required to go out to RFP. And so after many hours of reading and writing and presentations and scoring, the Exchange now has a new agency of record. They were issued a letter of intent and quickly started working on the new contract, which started on April 1st of this year. And I'll just say that Nevada Health Link, as you all know, is an extremely complex account. We're a very different state agency, and there's a lot of work that still needs to be done. But the Abbey Agency, they hit the ground running, and you will see what we've been working on in their presentation. I also just wanted to inform the board and hopefully put your mind at ease a little bit, because we get used to working with other agencies. You know, we worked really hard on establishing and maintaining our Nevada Health Link brand. And so also while educating Nevadans on all federal and local state challenges and changes when it comes to health insurance. And so this marketing partnership with the new agency, the Abbey Agency, I just want to let you know will be a continuation of growth of Nevada Health Link's already very credible brand. So that's our goal. And so without further ado, I would like to introduce Connie Anderson. She is the VP of Client Strategy with the Abbey Agency. She'll review and introduce the entire marketing campaign. Marketing team, and then review aspects of our American Rescue Plan Act, because we put some time and money into advertising the American Rescue Plan. We'll talk about goals and strategies moving forward, and then how we've worked on onboarding the new agency. So thank you, Connie. I'll hand it over to you.
Thank you, Janelle. We appreciate it. Well, it's so great to see everyone. Some of you, like Valerie, we've worked with in the past, so it's so nice to see you. And most recently, I know we've worked with some board members on op-ed, so thank you for jumping in to work with us immediately. As Janelle mentioned, my name is Connie Anderson, and I work with the Abby Agency. Our team, when we approached this RFP, was so excited to see it. We felt like we had been gearing up for this for the past 8 to 10 years, really expanding our awareness of what's happening in Nevada, working with health insurance plans throughout Nevada, and then developing some partnerships with key agencies in Nevada that we thought could really bring a holistic team to the health exchange account. And help expand their reach. As Janelle mentioned, the Nevada HealthLink brand has been going through a lot of evolution, and it has really cemented its place in the state, and we wanted to make sure that we kept that going. So our team is joined by Marketing for Change. So Peter and Robert are on the phone from that team. And then we're also joined by Erica Avila's Consulting. So she's on the phone as well. So I'll let them introduce themselves in just a second. I'm going to share my screen. And we'll go into full screen mode. 1 second. Why isn't? All right. Can everyone still see that? Perfect. Okay. I'll dive into introducing our team a little bit. We are owned by Abby and Ty, husband and wife team. I'm sure many of you have come across them or seen them on Twitter or LinkedIn. They're always kind of engaging in what's happening in Nevada. We're also joined with Brian, our CMO. He's out on vacation, so not here today. And then Ashley Brune, I'll let you introduce yourself quickly.
Apologies, I was trying to get off mute. Hi, everybody, I'm Ashley. Nice to meet you and see you all via this virtual environment. My role with the Abby Agency is overseeing the PR department and team. And for the exchange, I oversee the PR outreach and what our team is working on, working closely with Janelle and Katie, and now Heather, that she's back. There are 2 other people on my team who can't be with us here today. And one of them is Owen Truesdell, and he really handles community outreach and sponsorships. Again, working closely with your team and Erica Avila's as well. And then another guy named Ben, who is basically our coordinator, who makes sure that we're staying on track and organized and helping us get all the stuff done. Nice to see you.
Ashley. And then we also work with Ashley Bear, a brand manager. I think she's listening in. She's not listed as a panelist, so you may not see her today, but she's listening in with us. And I work closely with her and Janelle and Katie and the team, making sure that all of our deliverables for this contract are moving forward on time, on deadline, and within budget. Here's some other members of our team. Tyson, our creative director, works very closely with our creative content director, David. He gets a better picture than all of us. And then we have Caroline, our digital director, and then Henry, and then Dr. McFalls, who we work with. We'll be working with him very shortly on some more insights and strategy as we move into messaging for the open enrollment campaign. And then I'll turn it over to Peter and Robert to introduce the Marketing for Change team.
So hi, my name is Peter Mitchell, and we're a national research and creative firm that's propelled by behavioral science and focused on social change. So we only do this kind of work, good guy work, and we've been working on the health exchange work since the ACA on the national level in Minnesota, in Texas, and in Florida. We're heavily involved for this in the research. We're leading the research, and we're also collaborating on the creative with Abby Agency. These are just 4 of the people that are probably most heavily involved. You're going to hear from the 2 oldest, myself and the baldest. Myself and Robert are here to talk about the research later in the presentation.
Thank you. And then Erica, I'll turn it over to you.
Hi, can you hear me and see me?
Yes.
Okay, yes. Awesome. I'm just getting in to my house. It was crazy on the 15, but hello everyone. It's great to see you. Great to meet you, Chairwoman Jameson. I was a previous patient of your amazing clinic, so I love you and your staff and all of your work. And it's been awesome to work with the Abby team and Marketing for a Change, and really we hit the ground running, not only from a Hispanic outreach partnership perspective, right, and working with our media, working on our advertising, but really from a multicultural and working with Black Image Magazine. We're working on engaging the AAPI community and really finding those opportunities. This week, I've actually on another project have been knocking on hundreds of doors, believe it or not, from 8 to 12. And it's really important for me and our team to really be on the ground, boots on the ground. What is it that people, what are they concerned about? What are they asking about? What's drawing attention? How do we address them? And it's awesome for me to bring some of that insight, those opportunities to Abby and the team, and really put those opportunities together. And I'm sure we'll be sharing more of just what we've been doing within the past month, right? Connie, I know we hit the ground, but Leandra's on my team, and we're looking forward to continuing to work on just securing on all assets and making sure that we're reaching the community throughout the state of Nevada. So thank you for having me.
Thanks, Erica. Well, as Heather and Janelle mentioned, we certainly jumped in at a busy time. We had to really look at what was happening in the marketplace and how to understand what was happening with Arpa and how to message this to both our current audiences that the health exchange is used to speaking to, and then new audiences that we now had access to with these expanded subsidies. So we dove into a lot of messaging development. That messaging development really led into our creative efforts, as well as some supporting collateral pieces that we'll show you. We've had to do a lot of ingenuity as we looked at approaching the American Rescue Plan and how we did communications and outreach. There was still a lot of, over media fatigue, I guess you could say, or media fatigue in general about subsidies coming from the federal government. So we had to look at some new ways to pitch media to get some coverage. We took a very op-ed heavy approach to help get some news out there, which we think was very successful. And then again, we had to take a different approach on social media as we went to message this to our audiences so that it didn't get lost in the shuffle as people were talking about other expanded subsidies. You'll see here 2 different creative campaigns that our team currently has in market. Both of these creative campaigns are very short and brief. We wanted to focus on the messaging and savings that were available. We wanted to provide very strong calls to action, such as claim your health insurance offer, and then you may find insurance as low as $0. We thought that both of those help to make a more immediate action to our audience members and get them to engage. Both of these have performed very well over the past month or so that we've been running these on social media. We will begin to, over the next month or so, start to optimize more towards the highest performing creative, but right now they're both performing fairly equally well on our social media, which is great. You'll see here in support of collateral pieces, our approach to community outreach is really about giving people resources so that they can use it to reach their audience members. So we created a new social media toolkit that's quite extensive with key messages, sample posts, graphic overlays, and then instructions on how to actually use those graphic overlays through social media channels. So it's been great to see our broker community and others use these as they go out and message this to their audiences. We've also created FAQ sheets, talking points, user reference guides. As Erica mentioned, it's really important for all of these to reach all of our multicultural audiences. So we've made sure that we're looking at including Spanish language in all of these collateral pieces. And then we're including imagery and photography of all of our audiences in Nevada as well. We've also made these documents ADA compliant so that anyone who's using an e-reader or other thing like that on the internet is able to access these. Here's a couple more examples of what these look like. We've adopted a pretty, what I would call simplistic approach to the design on the front page so that they have a very standard look and feel, so that when a broker or a partner that we're working with gets these, they know that these assets are about the American Rescue Plan. And then when they get to the next 2 or 3 pages with more information they're able to see and actually use that information on the next pages. I'll dive a bit more into approach and where all these are going. As we mentioned earlier, we really jumped in at an accelerated timeline. Usually we would like to spend a month or two getting to know what's happening on all of the channels, auditing the channels to understand what's been working, what areas of improvement exist across all of the communications channels. However, with the special enrollment period open, we had to dive in. And so our first month of April very much focused on our owned channels. And then our earned channels. So what we mean by that is looking at using our organic social media, our blog posts, and our newsletters and email marketing to really continue the messaging and getting the word out about ARPA. We paired that with a series of press releases throughout the month of April to make sure that the media was also informed about what was happening and able to use that information. Throughout the month of May, we adopted some more paid media tactics, including social media, as well as traditional radio advertising. Those two mediums were brought on very early in May to continue building the HealthLink brand and then continue building awareness of the special enrollment period ongoing. Those assets and those outreach will continue through August 15th. Throughout the month of June, which I can't believe it's almost the end of June, we are expanding our paid media opportunities to Google Display, YouTube, connected TV, and then out of home. So connected TV is what's considered streaming TV. So things like Hulu, Sling, Peacock, we're able to really target individual households with connected TV, whereas broadcast is a more general message, but with connected TV, we can target people who have been to the Dieter website or been on unemployment, so we can really expand into some of these new audiences. And then out of home, of course, is both traditional billboards that you would see when you're driving down the freeway, and then we're also expanding into mobile billboards, which are targeted billboards that drive around communities that we want to reach. So I just spoke a little bit about each of these tactics, so I won't dive into these. It is important to note as we look at all of our media tactics, we are using both English as well as Spanish language assets targeted towards Spanish speaking households so that we can make sure we're getting our message out to all of our audiences. And then here's a bit more about the digital media platforms that we are implementing as well. And then I'll turn it over to Ashley Brune from our team to discuss a little bit about the public relations successes.
Thank you, Connie. Does anybody have any questions for Connie before I begin?
Yeah.
Okay, maybe you guys hold them for the end. I just didn't know if we should break it up. So hi, everybody. Again, this is Ashley. Thank you for having us be here. So where do we start with PR? As everybody's mentioned, yes, we all hit the ground running. One of the first things that we like to do as an agency, especially on the PR side, is really look at our clients and who their partners are and stakeholders and where they've been and their relationships and start with those first. And what I mean by that is start with introductions with those partners or those players and find ways for collaboration. So we started doing a little bit of that in April, just to set our footing for, what is to come, well, in the midst of ARPA as well. And some of those strategies that we did is we sent out an agency release to basically statewide media, letting them know that we are working with you guys at this point. We also sat down with your broker grantees and had about our meeting with each of them just to get to know how they feel we're doing and what messaging could be better and or how we can work together and leverage their voices or how they can use the materials that we're working with and put them out. So that was kind of the relationship building side of things. I believe we also sent an email to our navigators and all of the rest of the brokers as well, introducing ourselves. In addition to that, we really hit everything with ARPA. So we put together an ARPA rollout plan And while I say, you know, we put together that plan in the beginning, that plan is very flexible as we're seeing news moments change. So we know what we're going after, but we're also being flexible with what's happening in the news environment. So pitches have changed pretty frequently. We're pitching new angles about, I don't know, every other month right now, just to make sure that we're staying on top of all the different messaging that's out there, as well as with the consumer audience and which publications they're reading. So as Erica will go into in her presentation, something that we may be pitching to a Nevada business magazine may be different than she's pitching to, say, Telemundo. So as far as just deliverables go in the month of May, I'll start there, or I guess I'll start in April. We did do the special enrollment launch, which included an English and Spanish press release announcement. And then going right into May, we switched up some different tactics as far as what pitches we were doing. We did a Google insurance data pitch where we actually took Google Trends and looked at what was trending in search for health insurance. You're able, if you guys aren't familiar with Google Trends, you're able to look at it and see, you know, how hot a search term is performing and or where it's hitting in what markets. So we were able to find some terms in Nevada, and we thought that those would be very good news hooks for the media. Also, when speaking with broker grantees, we heard a lot about healthcare scams. And so that was something that we wanted to get in front of. So we did work with a broker grantee on a content submission, as well as pitching some media segments. And then we also sent out an Arpa success numbers release, just letting people know how many people were actually taking advantage of the cost savings at this time. In May, and now moving into July, we've also, as Connie mentioned, taken more of a content submission op-ed approach. This allows us to get more of our message into a long format, readable story. And so we've worked with 2 board members, Quincy and Jonathan, thank you. And we have worked with 2 broker grantees. And a lot of those stories we put together in May, and they've started to publish in June. Right now, June is really picking up. I feel like we have been on fire with media right now. It felt like a little bit of a media fatigue, and now they're back in and interested. So we've been working on a cost breakdown by county pitch. We've been working on a pitch around for contractors and self-employed. And again, really working with these unique stories and different voices for different niche publications where we could submit content. Another thing that we're working on is, now that Heather's back, is getting her into some more of those media show segments that are more of like those longer format news, whether they're 12 to 30 minutes, and then some media desk sites across the state where she can meet one-on-one with editors or health reporters and talk about the state of health insurance in Nevada right now. Next slide, Connie. And then I don't think I really need to go into this slide too much. This really just talks about some publicity initiatives that we do. This is kind of always on the back end, making sure that, you know, Nevada HealthLink and the exchange are highlighted. So this goes over, you know, some award submissions that we've submitted on behalf of the brand and the relationship building, which I've already discussed. Do you guys have any questions on the PR front of things? Okay, great. So Owen Truesdale, who I mentioned, also works with me. He's not able to be on the call today to present. He's really spearheading community relations with Erica as well as the Hicks team. And what we've done here is we came on board and took an outreach strategy that we call our three-tiered engagement strategy. So we looked at all of the partners that Nevada HealthLink already has and what our list of partners were, and we're basically building this new robust list from scratch. So from the beginning, we're starting with government agencies and elected officials, and then going into strategic partnerships with community organizations, which is kind of happening simultaneously, as well as from there, so from that, we're doing broad information sharing and amplification, meaning once we get these partnerships solidified and in a more formal, tangible way, we'll work with them on basically disseminating our information. So the team is full steam ahead on this one. They've already begun outreach. We are also looking at, sponsorships and community events that make sense for Nevada Health Link to have a presence at. Really making sure that we're looking at events that aren't just what I would say slapping your brand on something, but are allowing us to have an experience and be there and meet with people one-on-one who are our consumer audience. So we're being very conscious of that and conservative with our dollars. Connie, is there anything you want to add to that?
No, I think that was great. Thank you.
Okay,
Erica,
great.
do you want to talk a little bit about Hispanic and multicultural outreach? Your team has obviously been very involved in the PR and community outreach side of things.
Sure. Let me unmute camera myself. In at least for Southern Nevada as well as Northern Nevada, we know we have to get creative when it comes to outreach and engagement, especially in the summer months. But we've really, through our partnerships and relationships, have been able to leverage really getting the boots on the ground. So Están Tus Manos, which is another campaign I'm leading, is I manage, but Clark County led. We brokered a relationship with them where basically every weekend, the entire month of June, we have navigators as well as our campaign ambassadors talking at supermarkets right now. So the feedback from that has been phenomenal in terms of what are people asking, what is type of the information is it that they're taking, and how do we develop content and assets around that. So that's been really great, as I know that was really important when we met with Rosa, Janelle and team, is really how are we finding these new opportunities to get in front of the community. We also are working on additional partnerships with the Las Vegas the Latino Bar Association, with the public charge rule, and just making sure that we're engaged with the legal field, as we know they are trusted voices in the community. So making sure they're equipped with healthcare information and really looking at that from a long-term approach. So with all of these, there's short-term wins, but also long-term strategies on developing those out. Same with the Urban Chamber of Commerce and NAACP. We were very proud to sponsor that. This was their first breakfast of this event and celebrating Juneteenth and really getting our brand. I have a follow-up meeting with the NAACP of how do we really make sure we're talking with all the different communities in an authentic manner, and really just being creative and making sure that we're delivering. The other one not noted on here, unless there's an additional slide, is we also did something which we'll be launching next week with RTC, the Regional Transportation Commission of Southern Nevada. They do a summer heat campaign. So we worked with them and we'll be sponsoring some of the bottled water. But basically, again, anywhere that they're at transit centers, bus stops, we'll be able to have our team there, our branding, to make sure as transit riders, are staying hydrated, are staying cool, that we're also having that direct touch point. And not only our ambassadors, but also the navigators. So with all of these events, we're getting leads. So we're getting email addresses, phone numbers. At Mariana's, one of the great stories, we were in the employee break room. Mariana Supermarkets, they have 6 chains here. And even the employees, they didn't have health insurance. So it's really been rewarding in this past month to get creative with these organizations, partnerships, looking at all of the different jurisdictions and having, meaningful conversations and developing long-term strategies. Hopefully I covered it all.
Yeah. Yep. Great job. Thank you, Erica. I'll dive into social media a bit here. We believe that social media is a very important and critical part of community engagement. It's obviously a way for us to continue speaking with our audience members on a daily basis. So we have maintained quite a bit of the brand standards that have been developed throughout the social media channels, as well as the frequency of messaging. So we've seen over the past few months an increase in impressions on each platform, which we're very happy to report. We're playing around with time of day when we post a lot, which we credit those successful increase in impressions to that. I'll talk a bit about web here. You'll notice that our web traffic statistics remain constant or show a slight decrease over the months of April to May. That's due to the fact that we weren't running advertising in the beginning of April due to the changeover. However, noting that the decreases are only, between 1% and 3%, those aren't super significant, which is good. That means that we were able to really maintain interest in going to the website through our own channels by making sure that on social media, our newsletter, through our PR outreach, we were really pushing people to come to the website traffic or come to the website. So website traffic didn't dip as much as we would have expected without advertising dollars in market. We have advertising in market now. So on our next board report, these numbers will be quite different. You'll see here that newsletter was quite a success story throughout April, May, and the beginning part of June. We used the newsletter to really encourage a lot of clicks through to the website, to encourage people to update their applications if they're a current enrollee, or to go enroll if they were not enrolled yet. We did a lot of list cleaning. So we sat down with the health insurance team and looked at all the lists that are in our newsletter CRM right now and cleaned them up. So we were able to send them to the right people. The click-through rates and open rates of the newsletters throughout the first 3 months of working with you are much higher than the industry standard. So that's great, and we can plan to continue this success. All right, then I will turn it over to the Marketing for Change team to talk about the research that we have also been conducting while getting all of these assets out in market.
So this is a look at what we're doing and done and are going to do, but the real story here is what we're trying to accomplish by doing this. So we're going to be doing a biannual, twice a year pulse check. So this is a pretty rapid survey where we're out there asking a limited number of questions to kind of just see where we are with awareness and attitudes. We'll be talking about that more in a moment, the initial results. We also did our first qualitative. It was an online multi-day bulletin board. Robert's going to talk a little bit about the findings there. In September, we'll be doing a more in-depth survey, looking much more at the audiences that we're targeting, the uninsured and the people currently on the marketplace. That is sort of our gold standard of how we'll see how we're doing all the time. We have these biannual pulse checks to kind of give us what's happening in between. We'll also be doing more qualitative in the fall to inform the creative that we do in open enrollment. So that's sort of the beat of things, and you should feel pretty regularly informed. We'll go to the next slide. So I want to talk about what we found so far, and so the good news is that Nevadans who know a lot about Nevadans who know about the Nevada Health Link feel positive, overwhelmingly positive, have a favorable opinion, but less than half know enough to have an opinion. So this is where we'll be really focusing and trying to bring up the numbers to be more like healthcare.gov, Obamacare, Affordable Care Act. We want to get up to that level and hopefully beyond it as we work on awareness. You'll see the Silver State Health Exchanges on this as well, but that's not really our focus. The real brand out there is Nevada Health Link. Go to the next slide. So the good news here is the uninsured, over 50%, plan to get health insurance. That there is an appetite for it. Of course, the more difficult news is the awareness is lowest among the uninsured. That's not really surprising. It's similar to what happens in other states, but it is something that we want to work on because we want to be the first thing that people think about for insurance. Go to the next slide. So this slide shows an opportunity that, there's not a lot of awareness. There's some awareness, aided awareness of the American Rescue Plan Act, but most people do not know about that there's financial help under the American Rescue Plan to get your insurance premiums lowered. Go to the next slide. And this is a look at another opportunity, which is people that had a larger family were more likely to expect a higher price than they would actually get on the exchange. And this is a little bit of a confusing slide, but as you can see up toward the top, on that top is sort of the average when we ask people on average what they expected. That's sort of where the average came out. You know, people were all over the place. And then when we took the average person and we kind of ran it through and how much it would cost, you could see like the single people were like pretty much right on target. But as you had more and more people in the household, people expected it to be more expensive than it is. So that's a delightful reaction that you want people to get to. So part of this is just getting people to check their price. It's a little easier ask than, you know, sign up for health insurance right now. So, but it gets them into the marketing funnel. So I'm going to turn it over to Robert now, who's going to talk a little bit about the qualitative research.
Yep.
And then we'll have questions.
So this was the qualitative exploratory part of the work where we got to dive into some of the numbers Peter just went through and really understand why people felt the way they did. We really were interested in understanding what people are hearing, thinking, and feeling about both insurance, HealthLink, Arpa, all of the associated issues. So we started out the conversations very broadly, and then we slowly zeroed in on HealthLink and then some creative concepts for open enrollment that we'll get to. And on a couple of these slides, well, on all of them, in fact, we've included, you know, quotes that are from participants, because in a lot of ways they can be more enlightening than the bullet points we come up with. But this first slide really reinforces that the past year is put a real spotlight on health and health insurance for folks. And I won't read these quotes, but I did want to emphasize some of the language that they used. And these were illustrative of all the things we heard. Words like scared and haunted. So there's a lot of intensity and emotion behind the way people talk about the topic. Go to the next slide, Ash, or Connie. People think there's a perception that things are going in a direction that we'd like them not to go. People think that costs are going up as opposed to going down. As in one of the earlier slides, you know, a lot of this is because people are not aware of Arpa. They're not aware of the enhanced subsidies. But this was the case even for, some people who had gone to the HealthLink recently. And just in terms of timing, keep in mind, this was conducted 2 weeks ago. So enhanced subsidies had kicked in, but, they weren't getting through to people, the folks that we talked to. You can go to the next slide, thanks. The work extended over 3 days, so we were able to expose people to the HealthLink site. Even, some had been to it, some had not, but we made sure they all did. They all found it very intuitive, easy to get their price. So this was a little mini usability part of the project that we did. But what we did find is that a number of people, even those who did qualify for APTC, still found the plans too affordable. So that's not uncommon. We, in our work with the national marketplace, we know there's always going to be, a challenge to meet everyone's expectations. So the last thing I'll walk through is we tested 4 creative concepts to help inform the open enrollment campaign. And the idea wasn't to pick a winner out of any of these. The idea was we wanted to try distinct conceptual approaches based on barriers that we had uncovered in all our work for the marketplace. So each of these was trying to do a different thing. And the way we'll use these is to get insights on what conceptual approach worked, as well as what some creative details. So I'll walk through these quickly and just let you know what they were intended to do. This was trying to use a metaphor of 2 different doorways. We know a lot of people still don't know what exchanges are. There's misconceptions that it's government insurance. So we used a well-known brand in the state to emphasize that really the metaphor is that it's the same insurance you can get elsewhere, but if you go through the HealthLink, that's the only place you can get subsidies. And this was the one that was, had the most broad appeal. This game show kind of format was attention getting. The use of the Anthem brand lended a lot of things, credibility and different things. So we learned a lot from testing this one. We know that a lot of people rely on word of mouth, and if your neighbor doesn't qualify or your friend doesn't qualify or doesn't get a subsidy, there's a big likelihood for people just to assume that they won't. So one thing that we've always tried to convey is people in different circumstances can have different premiums. So that's what this kind of what your number was. We had 2 people some things are similar, but at the punchline is they get different premiums. The idea of tailored prices came through very strongly and was very effective. We learned a lot of things about the creative on this that lends itself to targeting. The fact that we had 2 younger people in there made the older respondents think that younger people get less costly insurance. So there's some a lot of good nuances and details we learned, but the concept, sort of the foundation of the concept was appealing to people, that things were tailored for everybody. This one was a completely different approach. This was trying to tie into milestones like graduating school, getting car keys, your first apartment, really putting kind of an emotional appeal to getting health insurance, that it is sort of attainment, it's accomplishment, it's progression in life. And this was one that's very targeted, much more appealing to younger people, as you can see in the quotes. So there is a way that we've, if we want to use this for older participants who their sentiment was, well, insurance isn't making it, it's really surviving. So if we can either target this towards a younger audience or make some adjustments to it to make it more appealing to a broader audience. But again, there was lots, it served its purpose in the sense of helping us learn a lot about this approach. And then the last one with the baby, this again was a different take on that. Not costs aren't one size fits all. So don't just assume that if your circumstances aren't right, you're not going to get a good premium, a good subsidy. So similar to the what's your number, the second one we looked at with a different approach. And again, we learned a lot of things that this is very appealing to some people. It's sparks different connotations. People without families think it has to do with families, and again, lots of interesting details and ways that we can improve it. Or if we went forward with this, is having a series of different imagery that doesn't sort of zero in on one particular demographic, or that shows a range of people. But again, good feedback on that one, and I believe that was we tested 4. So so that was the end of the bulletin boards.
Thank you, Robert. Well, we're at the end. What next? I did want to just help preview what we're planning for the next quarter to look like. Being able to really hit the ground running has allowed us to review our strategy and our creative approach in real time. So as you've seen already, we've been able to put so many assets into market and get real-time feedback, and then putting this research into market, we've also been able to get real-time feedback. And what that all means is we can really capitalize on the momentums and learnings we've had to build our open enrollment campaign. So we're working with Janelle and her team to develop that campaign now, so that we have the opportunity to create creative that we think will fit, that can be expanded throughout the open enrollment campaign period, and make sure that it's reaching all of our target demographics. You'll note some other things in here. We believe that continuing to work with all of our stakeholders to listen to individuals who are part of our new target audiences will be very important. So we're looking at executing some sort of listening tour throughout the state over this summer and fall. And then we're hoping that this year may be the year that we get to do a large in-person kickoff pep rally with brokers, navigators, and perhaps the public. So there's ongoing internal planning meetings around that. We don't have full plans yet. We want to make sure that we're being cognizant of what's happening with the coronavirus pandemic, what's happening with restrictions throughout the state as we look forward into that. And then we'll make sure that we're continuing to take advantage of the increased opportunity for sponsorships and events. As the team has noted throughout here, people are starting to get out into the public more, and we want to make sure that we are at the events where our target audience memberships are, but we want to make sure that we're leveraging those relationships and that in-person opportunity into ongoing relationships with our target audiences. So that includes getting their emails so we can add them to our newsletter list. That includes creating more cohesion between the event or the organizations that putting on that event for social media sharing, for newsletter sharing of them about the Nevada Health Link. So we're very excited for the next quarter, and we're here if you have any questions at all.
Did anybody? Oh, yes, Valerie.
Oh, thank you, Madam Chair. Valerie Clark for the record. I just wanted to let you guys know, I think this looks very, very comprehensive and informative. So I applaud you for all your hard work. And I was just curious on the toolkits and things that you mentioned. Will those be on the website, or where would we access that information?
Correct. They are on the website under partner resources currently, both English and Spanish versions.
Oh, very good.
But
Awesome.
I can email them to you as well if you'd like directly.
Either way, that would be great if you don't mind.
Yeah,
Thank you.
of course.
Great job, you guys.
Thank you.
Any other comments? Yes, I would echo what Valerie said. Outstanding. Great job.
Thank you.
You know, sometimes you think you've been around and seen that, and what new could these guys possibly bring? But sometimes even old stuff is great. And I got to applaud Erica Aviles for her getting out there at grocery stores and bus stations, because that's where our population is, and going back to boots on the ground. Bravo. That really is amazing, because the rest of you are so high tech, you know. So I'm glad she's got those boots on the ground.
Yeah.
And then, wow, marketing. Wow. I mean, these tested ideas. Okay, I wasn't going to say, I was skeptical. What could you bring that we haven't seen? It's so novel, so sophisticated, so totally brilliant. It's so simple, but powerful. Kind of things people connect with. The game show, what's your number, asking that question, not one size fits all. As an OB, of course, I love it. And I totally brilliant. Robert, really great job presentation. I just wanted to ask, are we going to, I know people think a lot of things are getting old, but is there going to be anything to a campaign about continuing our people, encouraging them to get vaccinated?
We do connect regularly with Immunize Nevada and then the Nevada COVID Response Instagram and Facebook pages. And so through social media, we are continuing to share that message regularly. And then of course the Vax Nevada Days, which the governor and his team have just launched. We are promoting that on social media as well. We can certainly look at adding it into some newsletter content and things like that, so that we're really that resource on healthcare overall. That's a great idea.
Yeah, because that's, as we all know, been the most amazing year.
Yeah.
None of us have ever seen a year like the COVID year in the history. And we want to make sure that our patients don't have to utilize this health insurance they're purchasing. And an ounce of, you know, as physician, ounce of prevention worth a pound of cure. Worth a pound of cure. So that's why I was just wondering, because your presentation was fabulous. Just want to make sure we're all over that vaccine somewhere. Heather, were you trying to say something?
Yeah, I was just adding, I don't think the Abby agency knows that I've been scheming on this whole vaccination and connecting our marketing campaign to the vaccination efforts in the state. So we've been engaged in the last 24 to 48 hours with several organizations on how we can do a better job of making sure that every time someone's getting vaccinated, they are also hearing about health insurance.
Love it. Thank you so much. Okay. All right. Well, thank you guys. That was absolutely wonderful. And let's move on now.
Dr. Jameson.
Yeah.
Just real quick, Heather, could we set up a separate conversation out this? Because what you just talked about in terms of the vaccinations, because you know the Nevada Minority Health and Equity Coalition, along with the Immunize Nevada, is coordinating a lot of those statewide equity efforts in the vaccination process. So make sure that we connect and see where there's opportunities for that to work together with the health exchange would be great.
Love that. Yes. And Madam Chair, Jose just notified us in chat that he needs to go, so we should probably try to get our vote on the fiscal and operational report before he does.
That is exactly where we are going. So approval of the again, thank you, Marketing Outreach. Approval of the semi-annual fiscal operational report pursuant the NRS code to the governor and legislators. Perfect timing, actually. And you guys all saw 32 plus pages. I'm sure you all read it in detail. Did anyone want to go ahead and have a motion for approval of this report and a second, and then we can have any discussions?
This is Jose, motion to approve.
Second?
This is Sarah.
Second.
Okay, and everybody in favor, say aye.
Aye.
Oh, I forgot to ask for discussions or questions or concerns. Having none, then everybody in favor, aye.
Aye.
And anyone opposed? Has anyone abstained? So that was a unanimous aye, a resounding aye, and great report. So we are now, and a discussion of possible actions regarding dates, times, and agenda items. We already went over some earlier. I won't repeat them. I know Heather and her staff have them. So was there anything else that anyone wanted to add?
Madam Chair, Heather Korbulik, I just wanted to make sure everyone knows that our next scheduled meeting is October 14th at 12:30 p.m. We, right now, there is no need to try to do any board meetings before that, but I'm excited to be able to share at that board meeting all of our confirmed carriers for plan year 22, and the confirmed rates should be set by that time too. So there will be a lot of good information at that next meeting.
Excellent. All right then, and somebody really rants me. So was there, besides Jose needing to go, so was there any, we had that voted, there's no other discussions for the special, for the agenda, we'll have a lot to cover. Any public comments?
There's none in the Carson office. Is there any online, Katie?
Nope, there's none in the chat.
All right then, I will entertain adjourning. All right, Valerie, and I know Jose's ready. So thank you, everybody, and have a wonderful day. And I hope some of you were able to enjoy this amazing monsoon thunderstorm that Las Vegas is just having right now. It's fabulous.
Congratulations.
Have a wonderful day.
Nice to meet you all.
Bye.
Bye. Bye-bye.